Today, the Executive Committee of Leader Blood Donation Society, LBDS, had the privilege of participating in a constructive and meaningful integrated health coordination meeting with the International Rescue Committee Health Team. The meeting provided an important platform for discussion, coordination, and strengthening collaboration in support of community health services. During the meeting, we shared detailed information about its upcoming community-based blood group testing campaign, which aims to expand access to safe and reliable blood services for vulnerable communities. We highlighted the importance of this initiative in strengthening emergency blood response systems and creating a sustainable database of voluntary blood donors within the community. To effectively implement this initiative, LBDS formally requested support in the form of blood grouping and screening materials, including testing kits and other essential supplies. In addition, we emphasized the need for capacity-building training for selected LBDS volunteers on blood group testing procedures, basic donor screening, and eligibility assessment. Such training will help ensure accuracy, safety, quality assurance, and compliance with accepted medical standards. The discussion clearly reflected the shared vision and commitment of IRC and Leader Blood Donation Society to saving lives, strengthening health systems, and serving the most vulnerable communities. We look forward to continued collaboration and partnership to enhance community-based health interventions and improve emergency response outcomes. We sincerely express our gratitude to IRC for organizing such a meaningful meeting.